Hello learners, our today's topic is community-based care for elderly persons and social work intervention. Let's begin with elderly care. Elderly care, or simply we can say elder care or aged care, this serves the need of old adults. Actually, elder care is an umbrella term for a wide array of services intended to help older people live as comfortably and independently as possible. It encompasses assisted living, adult daycare, long-term care, nursing homes, hospice care, home care, even residential cares. Just look at this picture. Our elderly people, they have lots of needs and they require assistance and help in all those needs. Let's look at this one by one. What are the needs of the elderly? Family support, medical needs, home safety, cognitive health, mobility, personal hygiene, help in meal preparation, and social interaction. A huge part of an elderly person's needs are the psychological needs also. Emotional needs of the elderly are often neglected due to the focus on physical needs, which seems more urgent. Cognitive decline and physical issues may cause a bit of an unintentional social withdrawal, causing mental health issues. Let's look at the area in which the aged people require support. Let's start with personal care. Assistance with activities of daily living, such as help with bathing, toileting, dressing, eating, and grooming. It's very important because it is for our day-to-day life. As people age, many of them need help with these daily tasks to maintain personal hygiene. Good personal hygiene is important for health and well-being. It also helps build self-esteem and confidence. Poor personal hygiene can cause uncomfortable infections and different type of skin diseases and complaints. Another important area in which these people require support is the nutrition services. Nutrition programs specifically designed for the elderly aim to address the unique nutritional requirements and challenges faced by this group. Let's see some of the important features of this program. First being the nutritional assessment. Comprehensive assessment can be conducted to identify the nutritional needs and deficiencies of individual elderly participants. This includes evaluating their dietary intake, health conditions, medications, and physical activity levels. As the elder adults cannot eat everything, they require personalized meal plans. Based on their nutritional assessment, personalized meal plans can be developed to meet the specific dietary needs of every individual. This plan will of course focus on balanced diet with an emphasis on nutrient-dense food including fruits, vegetables, whole grains, lean proteins and healthy fats. As they cannot cook their own food most of the time, meal delivery services is equally important. This ensures that the older adults receive nutritious meal even they have limited mobility or they are living alone. This service provides convenience and eliminate the barriers to access healthy food. At the same time, nutrition education is equally important. These sessions and workshops should be organized to raise awareness about healthy eating habits, portion controls, and the importance of specific nutrients in their life. This helps them to make dietary choices and enables them to maintain a healthy lifestyle. Social interaction can also be possible through nutrition by arranging group meals and activities which foster them a sense of community and concern among older adults. So, if we talk about the support services, in which area they need most is personal care, because you see, every person's personal care is unique and it helps them by fulfilling those needs with bathing, cleaning, showering, shaving, assistance with medication, their eating habits, their toilet assistance, their laundry, changing the bed, skincare, utilizing the local services, or if they want to see the friends and family. As people grow older, these tasks become equally difficult and they require help at every field. Health, a very important factor in everybody's life. Health care for the elderly, also known as elder care, it includes a variety of services and options, such as they may need assisted living, facilities that help with daily activities like dressing, bathing, medication management, memory care facilities. These facilities are for some special people who are having memory related conditions like Alzheimer's or dementia. Memory care facilities are for people who specialize in caring for people with memory related conditions like Alzheimer's and dementia. Some people may require home nursing services. Geriatric care management is equally important. The process of planning and coordinating care for the elderly to improve their quality of life, maintain their independence, and meet their long-term needs. Geriatric medicine, a medical specialty that focuses on wellness, preventive health, and managing chronic medical conditions. Mental health issues are on rise. Counseling services that can help older adults and caregivers deal with stress, understand their feelings, and develop plans for unexpected events. Other type of elder care might include adult daycare, long-term care, nursing homes, and hospice care. Medication management is another important part of health management. It is important for all the senior citizens so that they get their medication on time and avoid overdosing or missing any medicine. A caregiver can work with a senior people and their doctor to develop a plan and schedule that work for them. The caregiver can keep a track of the their medication schedule and ensure that they are taking the required medicines on time. Another important area in which the senior citizens need help is mobility and transportation. Generally, seniors experience challenges with mobility. This can mean challenges with getting around within their home, outside, or challenges with driving or accessing public transportation. This is one of the very important service which they can be of great help for them if it is provided. A caregiver can help a senior get around their living space, preventing falls and injuries. A caregiver or transportation service can help a senior get medical appointments, visit to different sites, and many other things. Finance is another important part in anybody's life. Seniors also need assistance with things like managing their money. Planning after retirement can be stressful. Even seniors who have saved throughout their life has to periodically reevaluate their financial situations. They are on higher risk of becoming a victim of financial scams. Assistance with money management can help avoid any unnecessary spending or from financial scams. They can take help of trusted friends or any other family members or from outside in their day-to-day finances, like paying their bills, making a budget, taking care of their money, etc. Safety and security is another important area where senior citizens or older adults require help. They are at a high risk of experiencing an accident other than. Seniors are at a higher risk of experiencing any type of accident than any other age groups. They can fall or have accidents while on road, so that has to be taken care of. At the same time, they become forgetful and forget to lock their doors or the cars, which can also put them at risk. There are a number of safety and security devices required for the seniors. Having a caregiver check on a senior and assist them with difficult tasks can help avoid accidents. Even they can invest in technology that can detect a security breach. That can be another popular option to keep them safe. Social interaction opportunities. Social isolation is a real problem in senior community. Social connections are critical to both mental and physical health. When seniors are lonely, they can experience real physical symptoms. An important senior service to invest in is one that allows you to get adequate social interaction. This can either be a transportation service that can take seniors to any social events or anybody else who can give them companion so that they don't feel lonely. Now let's look at the community-based care for the rural elderly people. Elderly people are not always just to lie down on bed. They can contribute to their families and society in many ways if they can maintain good health and proper mobility. For this to happen, their nutritional requirements and health problems, including the neuropsychiatric need, has to be addressed properly. A system has to be developed that can provide care for the elderly closer to their homes and covers not only health services but also addresses the social and psychological issues of the elderly. There are many schemes that the Government of India has in place for senior citizens. The government is aware about their need of love, care, medical, housing, etc. For this purpose, various schemes, programs are being implemented by the government for the welfare of older people. Now let's have a look on different programs and schemes for the older persons in India. The Government of India is implementing various schemes and programs to provide healthy, happy, empowered, dignified, and self-reliant life to senior citizens, along with strong social and intergenerational bonding. These programs improve their quality of life and promote active and productive aging. Let's see some of these programs briefly. We'll start with Integrated Program for Older Persons, IPOP. Integrated Program for Older People is a central sector scheme under the Ministry of Social Justice and Empowerment. It aims to improve the quality of life of older persons in the country. Under this program, grants are given for running and maintenance of old age homes, daycare centers, mobile medical units, multi-facility care center for older widows, etc. The main objective of the scheme is to improve the quality of life of older persons by providing basic amenities like shelter, food, medical care, and entertainment opportunities. The implementing agencies for this scheme who are eligible to get the assistance are Panchayati Raj institutions, local bodies, non-governmental or voluntary organizations. Funds under this scheme are not released to the states but are directly released to the implementing agencies. This scheme had been made flexible as it tries to fulfill the diverse needs of the senior citizens. With effect from April 1st, 2016, the Ministry has revised the IPOP scheme by the merger of following components of non-plan schemes in the existing plan scheme of Integrated Program for Older Persons. The Awareness Generation for Maintenance and Welfare of Parents and Senior Citizens Act 2007. Setting up of helpline for senior citizens at district level. Scheme for implementation of new national policy on senior citizens. The next scheme which we are going to discuss is Rashtriya Vayoshri Yojana, RVY. Rashtriya Vayoshri Yojana is a scheme for providing physical aids and assisted living devices for senior citizens belonging to BPL category. This is a central sector scheme fully funded by the central government. The expenditure for implementation of the scheme is met from the Senior Citizens Welfare Fund. The scheme is implemented through the sole implementing agency, Artificial Limbs Manufacturing Corporation, ALIMCO, a public sector undertaking under the Ministry of Social Justice and Empowerment. Under the scheme, the physical aids are provided only to senior citizens of the country. This implies that those who are aged above 60 years will get free assisted living aids and physical devices which are required for their sustainability. Also, the government has selected the list of cities where the scheme will be implemented. The main criteria for the senior citizens to get full benefit of Rashtriya Vayoshri Yojana scheme is that they must belong to the BPL family and should hold a valid BPL card issued by the concerned authority. If we talk about the eligibility case in this scheme, the senior citizens belonging to BPL category and suffering from any of the age-related disability or infirmity like low vision, hearing impairment, loss of teeth, and locomotor disability will be provided with such assisted living devices which can restore near normalcy in the bodily functions, overcoming the disability or infirmity manifested. The scheme is expected to benefit all senior citizens across the country. The devices which are supported in this scheme are walking sticks, elbow crutches, walkers or crutches, tripods or quadpods, hearing aids, wheelchairs, artificial dentures, spectacles, etc. In this scheme, free of cost distribution of devices commensurate with the extent of disability, infirmity that is manifested among the eligible senior citizens. In case of multiple disability or infirmity manifested in the same person, the assistive devices will be given in respect of each disability or impairment. Artificial Limbs Manufacturing Corporation, ALIMCO, will undertake 1 year free maintenance of the aids and assisted living devices. Beneficiaries in each district will be identified by the state government, union territories, administrations through a committee chaired by the Deputy Commissioner or District Collector. As far as possible, 30% of the beneficiaries in each district will be women. The state government, union territory administration, district level committee can also utilize the data of BPL beneficiaries receiving old age pension under the NSAP or any other scheme of the state, union territory for identification of senior citizens belonging to the BPL category. The devices will be distributed in camp mode. Next scheme which we are going to see is Indira Gandhi National Old Age Pension Scheme, IGNOU. The Ministry of Rural Development runs the National Social Assistance Program (NSAP) that extends social assistance for poor households, for the aged, widows, disabled, and in case of death of the breadwinner. The scheme, Indira Gandhi National Old Age Pension Scheme, is one of the 5 sub-schemes of the National Social Assistance Program. Under this scheme, the beneficiary will receive a monthly pension. The interesting part about this scheme is that it is non-contributing scheme, which means that the beneficiary does not have to contribute any amount to receive the pension. Under this scheme, financial assistance is provided to the person of 60 years and above and belonging to family living below poverty line as per the criteria prescribed by Government of India. Central assistance of rupees 200 per month is provided to a person in the age group of 60 to 79 years and rupees 500 per month to persons of 80 years and above. The pension amount which they are going to receive will directly be credited to their bank account as furnished by the beneficiaries or in their post office account. Another scheme is Varishtha Pension Bima Yojana (VPBY). The Government of India announced the revival of the Varishtha Pension Bima Yojana in the Union Budget 2014 and 15. The VPBY is administered through the Life Insurance Corporation of India. This scheme benefits senior citizens aged above 60 years and offer them income security with a guaranteed rate of return. Under this scheme, the pensioners can buy a policy at the purchase price by paying a lump sum amount. After buying the policy, a pension will be payable monthly, half-yearly, quarterly, or annually. The pensioners can choose a pension payment frequency according to their convenience and needs. Some of the features of LIC Varishtha Pension Bima Yojana is this scheme has a lock-in period of 15 years. Regarding the inclusion, the policy holders can avail of a loan after the completion of 3 years up to a maximum of 75% of their purchase price. The loan interest will be recovered from the annuity payments. Regarding surrender of the policy, in case of any critical illness, the policy holders can surrender this pension yojana within 15 years of opening. They will receive up to 98% of the single premium paid. If the policy holder surrenders the policy after the completion of 15 years, then they can get up to 100% returns on the single premium. Regarding cancellation, the policy holders have the option to cancel this policy within 15 days of receipt of the policy documents, provided there is no claim. Our next scheme is Pradhan Mantri Vyay Vandana Yojana. The Pradhan Mantri Vyay Vandana Yojana PNVVY was launched in May 2017 to provide social security during old age and to protect elderly persons aged 60 and above against a future fall in their interest income due to uncertain market conditions. This scheme enables old age income security for senior citizens through provision of assured pension return linked to the subscription amount based on government guarantee to Life Insurance Corporation of India. The scheme provides an assured return of 8% per annum for 10 years. The differential return, that is the difference between return generated by LIC and the assured return of 8% per annum, would be borne by Government of India as subsidy on annual basis. Pension is payable at the end of each period during the policy tenure of 10 years as per the frequency of monthly, quarterly, half-yearly, yearly, as chosen by the subscriber at the time of purchase. Minimum purchase price under this scheme is 1,50,000 rupees for a minimum pension of 1,000 rupees per month, and the maximum purchase price is 7,50,000 rupees for a maximum pension of rupees 5,000 per month. This scheme is exempted from goods and service taxes. Next program is National Program for the Health Care of Elderly, NPHCE. The Ministry of Health and Family Welfare had launched the National Program for the Health Care of Elderly during 2010-11. This program is to provide dedicated healthcare facilities to the senior citizens at various levels of primary, secondary, and tertiary healthcare and to address various health-related problems of elderly people. The objectives of this program is to provide accessible, affordable, and high-quality, long-term, comprehensive, and dedicated care services to an aging population, creating a new architecture for aging to build a framework to create an enabling environment for a society of all ages, to promote the concept of active and healthy aging, convergence with National Rural Health Mission, Ayush, and other line departments like Ministry of Social Justice and Empowerment. The major objectives under district level activities of the NPHCE are to provide dedicated health facilities in district hospitals, community health centers, primary health centers, and sub-centers level through state health society. The healthcare facilities being provided under this program are either free or highly subsidized. The following facilities are being provided under the program: geriatric OPD and 10-bedded geriatric ward at district hospitals, bi-weekly geriatric clinic at community health centers, weekly geriatric clinic at primary health centers, provision of aids and appliances at sub-centers. In this scheme, the center will bear 75% of the total budget and the state government will contribute 25% of the budget for activities up to district level. Now we come to the role of social workers. Social work intervention. Gerontological social work interventions are directed at enhancing dignity, self-determination, personal fulfillment, quality of life, optimal functioning, and ensuring the least restrictive living environment possible. Specializing in older people, geriatric social workers are trained to find solutions to help address the numerous environmental challenges that comes with aging process. Geriatric social workers support clients and their families through a combination of psychosocial assessments, care coordination, counseling and therapeutic work, crisis management and interventions, and discharge planning. Let's see how social workers support their clients through these methods one by one. Psychosocial assessments. Gerontological social workers conduct psychosocial assessments to determine their clients' mental, emotional, and social needs, and to understand how these needs connect with their physical health and medical conditions. Mental and physical health are closely linked, and by gaining a holistic picture of clients' mental, emotional, and social circumstances, social workers help clients, medical care providers, and their families better understand how to develop a care plan as comprehensive and compassionate as possible. Psychosocial assessment gathers information on a client's mental and emotional health, including past and present psychological conditions, behavioral health challenges, social, financial, familial, educational, and occupational history and current situation, medical and mental health treatment history, current medications, and adherence to the treatment plans. Gerontological social workers complete psychosocial assessments at the time of a client's admission into a given care program. This is also known as intake assessment or intake history. And also, they conduct regular assessments throughout the client's time in the program. Care coordination. Another responsibility that gerontological social workers have is care coordination. This is the purposeful organization of different teams and services to effectively address a client's overall healthcare needs, which includes physical, cognitive, emotional, and social needs. Care coordination involves completing psychosocial assessments to inform the larger treatment team of a client's need. It also means participating in or facilitating meetings between different providers to discuss patient treatment and the health outcomes, conveying the concerns and desires of the patient and his or her family to the teams involved in their care, and also connecting clients and their caretakers with resources within the larger community that may provide additional support. Counseling and therapy. Gerontological social workers provide counseling and therapy to clients to help them cope with the psychological, emotional, social, and financial challenges that comes with aging. They also provide therapy and advise clients, families, and loved ones as necessary when and where possible. During the sessions with clients, social workers may employ a variety of psychotherapeutic techniques to help them manage negative emotions, set objectives for life improvement, address behavioral problems or psychological barriers to meet certain goals, and make end-of-life preparation where applicable. When working with the families of the clients, gerontological social workers may help them manage the difficulties they may encounter caring for an aging loved one, including strains on financial resources and relationships, and processing grief and other emotions around loss. Specific therapeutic techniques gerontological social workers may use in their work with clients and families may include cognitive behavioral therapy and dialectical behavioral therapy, problem solving therapy, motivational interviewing, and mindfulness based stress reduction. Crisis management and interventions. Many of the clients can encounter the crisis situation. Depending on their role and work setting, gerontological social workers help their client with this crisis situation. They may be victim of neglect, domestic abuse, exploitation, and other crimes. Clients may be victims of neglect, domestic abuse, exploitation, and other crimes. Some clients may struggle with depression, suicidal desires, acute dementia that renders them to be unable to care for themselves, family conflicts about treatment decisions, traumatic experience that require immediate help, or mental or emotional disorders that can be a threat to their life. Gerontological social workers may also provide crisis support, and interventions in non-medical settings. Styles also help the older adults during crisis situations by coordinating volunteer services for the suicide prevention and grief support hotline. In these instances, gerontological social workers may have to intervene with a number of measures to ensure client safety and their well-being. These may include providing emotional support and counseling to clients and their family members, managing difficult conversations between the client, family, and care providers, contacting relevant organizations and or authorities in the case of elder abuse, and also developing a short and long-term support plan for clients and their loved ones. Let's have a look at the main duties of geriatric social workers. Social work and social services for elderly people will comprise of some of the following duties. First, providing information or providing the resources. There are many governmental and local social services which elderly people don't know about, but they are available for them. A social worker for the elderly will provide information on all those resources available to fill a particular client's support needs. Next is counseling. An elderly social worker that's licensed for clinical work can provide the counseling service for different emotional issues. They can help them take care of their emotional challenges and end of life planning also. Guidance and expertise. Things like Medicare insurance forms, any legal forms related to healthcare, any other forms or anything which is confusing for them and they are unable to do on their own. Social worker deals with these elderly patients who often rely on their guidance and expertise to assist them with navigating with complicated but important paperwork. They also work as advocate for seniors. Seniors are one of the biggest groups which becomes easy prey upon, especially when they are talking about some investment and they can be part of phishing scams. They can also be victim of different kinds of elder abuse by the family members or a caregiver. Social workers for elderly people can include being an advocate and helping to bring legal action against those that prey on older people. Clinical and social intervention. Seniors can often feel isolated and may not want to reach out for help. The social workers who are working for elderly can provide professional mental health counseling and connect these elderly people with support groups to encourage more social engagement to improve their quality of life. To conclude, it can be said that social workers' role lies in communication, including sensitive listening and awareness of non-verbal communication, taking time to assess needs, starting where the older person is, supporting people with managing crisis situations that arise through loss and change, like it can be bereavement or loss of any family member, changing their physical and mental health, supporting people whose lives are constrained by illness and disability, practical help, generating and organizing resources, working with other professionals, helping the helpers who are taking care of these social workers, helping the helpers including carers and colleagues, and finally combating ageism. So that's all for today. Thank you.